Hello, Dr. Leo Kormanik with Running Rehab. Basically for this exercise, we're going to use a simple foam roller to help incorporate some better back extension. And what we're really which is basically bringing the back this way. So a lot of times when we sit all day long, or we run, or we bike, we're stuck in this flexed position in our mid-back. And that's not terrible because that's sort of the motion that part of the spine is good at. The low back isn't good at that, but the mid-back actually is decent on that. The problem is when you go to run, the mid-back needs to have some slight extension because that is sort of what the glutes anchor on. And we know this in chiropractic that if we do like a quick mid-back adjustment, somebody's glutes will instantly wake up. Well, this is a way that you can sort of mobilize your mid-back and instantly wake up the glutes, have better posture, open up the rib cage so you can breathe better, all sorts of things. So this is especially important for like people that sit all day long or triathletes that basically are just sort of locked in this position, or people that might have like increased curvatures in the mid-back like Scheuermann's or something like that, okay? So simple foam roller, all you're really gonna do is you're just gonna kind of start sitting on it, and then usually I just cross my arms, come through, and you can hear some clicks and pops. You'll get some grinding, clicking, popping in the mid-back. And basically, you just kind of want to scan up and down the spine to get all those releases, okay? Don't really think about your low back. Nothing's going to pop in your low back, but more of your mid-back as they attach to your ribs. That's what you're feeling popping, okay? So just kind of scan it back and forth. Then sort of like where the most tension is as you're rolling through, you're like, oh, it doesn't want to move there. It's like a lot of pressure. Then just interlock your fingers, bring it behind, bring your legs up so you're in a nice relaxed position, and just really let that fall back. And here, it'll feel like a really good stretch through the diaphragm, rib cage, and obviously the mid-back, and even the chest. Don't force it, because you can go into spasm, but just kind of let gravity win, and just let your body sort of come back. Now, really just try to hold that for like 30 seconds or so. Safely rock back up, kind of do another scan. Just see if you find another segment that's not moving great. Right up into here is not moving great. Again, kind of do that and bring it back. If you're high up where your shoulder blades are, then you might have to sort of give yourself a hug here and then let it come back in this way. But usually if you're just a little bit around your shoulder blades or below them, this is a better option because then you can really pull through and get a lot more opening. And then you'll find when you get up, like obviously you'll feel like you're taller, and that whole activity and that whole exercise should maybe take a minute or 2 minutes, but instantly you can feel better mechanics there and you'll feel a lot taller, but you'll get better breath and better hip activation.